Okay, so welcome everyone to this Tortoise ThinkIn on the unheard voices of coronavirus, which we have organised it with our partners at Sounddelivery. My name's Polly Curtis. I'm an editor and partner at Tortoise. And for those of you who haven't been to a Tortoise ThinkIn before, welcome. Tortoise was founded a year ago, and the whole idea of Tortoise was to slow down and wise up. So to get off the kind of breaking news bandwagon and think about slower, smarter journalism. And the way we do that is by really listening to people. We listen to our members, ordinary people, experts. We spend most of our journalistic kind of capacity listening. And we do that through these conversations, which are called think-ins. In normal times, we're all in a room together, in our newsroom in London or around the country. We're settling for Zoom at the moment and finding different ways to have these conversations. But what we're about is bringing people together to better understand the journalism we're trying to do, the story we're trying to tell, or the story we might be missing. And we think that by listening to people from the broadest range of backgrounds, the broadest kind of parts of society, we will be able to get to a better form of journalism. So I'm just going to explain how it works. We've got some invited speakers who are really some of the unheard voices, the people you're not hearing from in coronavirus, who we want to kind of kick off the debate. But we'll also be encouraging everyone who's taking part to offer their ideas of the unheard voices or their experiences for us to pursue in our journalism, and for the stories that should be told that aren't being told at the moment. And the way you can join in is either by raising your digital hand. So if you click on the participants bar, you can then, it then reveals the list of participants and a little grey box that says raise hand. And if you raise your hand there, like hopefully some of my colleagues will do, who's doing that now? Sue Vanek, that's my colleague's mum. Thank you, Sue, is raising her blue hand, and you can see it there. If you raise your hand, thank you, Kamna, I'll come to you and bring you into the conversation. Alternatively, you can also leave some ideas in the chat, and we'll make sure that we bring you out so that you have a chance to make your suggestions, to tell your experience, and to contribute to this journalistic endeavour we're on. So this idea about unheard stories of coronavirus really came about a month ago when this whole thing was just starting, and we had a think-in where we were asking, is coronavirus going to be the great leveller? Or is there a poverty penalty? And we very quickly concluded that there is a poverty penalty, and that this disease will play out in very different ways and expose a lot of the cracks that already exist in society, and potentially offer some chinks of light in terms of change that might help us address some of these problems, but that we needed to really focus on the unheard stories. So we held a think-in 3 weeks ago, and we heard some extraordinary stories of people who were sex workers, domestic workers, homeless people, people who had really different experiences. And we produced a piece that ran in our app last week, and that reached many thousands of people through social media to tell those unheard stories. And we thought we would come back again tonight and address the unheard idea again, by bringing in some of the partners we have through the Tortoise network. So Jude from Sounddelivery is our partner through the Tortoise network, who has introduced us to lots of different charities and local activists and people who are trying to address some of these problems that we're talking about. So tonight we're going to look at two particular aspects of the unheard story. So one is the experiences of people who are in insecure work, 0 hours contracts, low pay, and how it's playing out for them. And then we're also going to look at a different part of our social care system, so how we look after the most vulnerable children through this time. And I wanted to start by introducing two people I met when we were holding Think-ins in Grimsby. And we went to Grimsby through the election and held 4 Think-ins, and we've been back since and really built up a membership within Grimsby. And Chris and Nikki were fantastic. Hi there, hi Chris and Nikki. Were fantastic Tortoise members who really raised a lot of issues through the election about politics, about how it was playing out for them in Grimsby. And I wanted to invite them here today because we're all kind of stuck in our local areas. As a journalist, it's very frustrating not being able to go out and report somewhere like Grimsby. So I wanted to hear that Nikki and Chris, can you introduce yourselves? Tell us a bit about yourselves and what you're doing through this period, and then give us like the view from Grimsby.
Yeah.
Hi, I work as a support worker in the community. It's okay at the minute. We've got PPE and everything, but some of my clients are a little bit on edge, should I say.
That's one of the face masks they're given.
Oh, is that your face mask? Yeah. And is it mostly older people you work with, Nikki?
Yes, yeah.
And is there more work to do or less work? Has it changed your working life at all?
There's a little bit less because there's a few people that only want like a set amount of carers going in. So,
So are you having to do more work when you go in? How does that work if there are fewer people actually going in to do the kind of up close personal work?
We have to do a little bit more work, obviously, because a lot of my clients are ladies who have hairdressers going in, and obviously because they've not got that now, we're having to wash, dry and style their hair. So yeah.
Thank you. And Chris, tell us what's happened with your work. You work normally in the fish factory, is that right?
Yeah, I work for Young's Seafood. At the minute, I'm not at work because I got a text message from my doctor saying I have to do a social shield. Unfortunately, so I'm just watching the world unfold. It's quite worrying at the minute as well. My company are one of the biggest they are the biggest employers in Grimsby, and things are changing quite interestingly there.
What's happening?
At the minute, we employ a lot of agency staff at the minute, and we haven't got them in at the minute. They're just not having as many people on site. The orders are bigger, but the staff is less. That's one of the big issues we've got at the minute. Social distancing doesn't really exist from what I can gather. One person walked out today because they wasn't feeling safe. So yesterday, weren't feeling safe with social distancing. So that's one of the things. And I'm just on sick pay at the minute, and it's not enough to live on at the minute. It's
how much is it statutory sick pay?
It's statutory sick pay. They've roughly paid me the equivalent of 11 hours, which I do 48 a week. The question I haven't been furloughed, by the way.
No.
Not sure why they haven't.
So because you have some kind of you have an underlying health condition, your doctor said you can't work, and that means you go on statutory sick pay, 11 hours as opposed to, so that must be quite tough financially.
Yeah. As opposed to 48 hours, it's quite a chunk, but we do get paid weekly, so you can just about budget on it. But they didn't pay me last week. They pay me tomorrow, and we'll see how it goes on with there. It is quite worrying.
One of the interesting things about Grimsby is that it has the second lowest rate of coronavirus in the country at the moment. So it's very low numbers.
24 deaths as of 1 o'clock this afternoon. 24 deaths. That's North Lincolnshire as a whole. That's Grimsby, Scunthorpe and the surrounding areas. We've got about 200 cases total. So it is, because we're the end of the train line, not many people have to visit unless you want to come here, unfortunately.
And it's so interesting because when I was up doing think-ins with you during the election, the end of the train line was really a kind of big problem for Grimsby, the lack of the connections. But actually, from this virus so far, it's kind of shielded.
Yeah, it's for once it's our saving grace. We're always complaining about the lack of transport here, but it's now it's just saved us really. People are worried, obviously, but they don't seem as worried. Locally, there's been all sorts of things happening. We have a beach near us, Cleethorpes Beach, and that's been empty for a change. It's normally rammed this time of year.
People are following the advice.
Taking the advice.
Yeah.
We've got 3 local parks, not many people in them, but the town centre itself has been really busy the last couple of days. Nikki had to go shopping yesterday, and it was just like a standard Saturday, wasn't it? Sunday, wasn't it?
Yeah, and no, it was absolutely packed out. There wasn't a lot of social distancing. I was trying to, but people kept coming up, so I kept having to step away. Yeah, it was absolutely packed, but it has been Easter weekend, so I think everyone had the same idea.
There's a really interesting point being raised in the chat by Natasha Devon, who says it seems really crazy that when the government's offering to furlough people for £2,500 a month, that people who need to be shielded are being put on statutory sick pay instead of being furloughed. Have you asked about being furloughed, Chris?
I've been trying to get hold of my HR department for the last 3 weeks, 3 weeks.
2 weeks,
yeah. And I've just not been able to get hold of them. The HR department have been told they can work at home, so that I don't know if they're and if they can't, they're coming in for a couple of hours, 3 hours a day or something like that, and they're just not answering the phones. So unfortunately, I'm not getting any response from anybody I work, other than the people I work with on social media. I talk to them on social media. That's it. Tried emailing.
Chris, what do you think about in terms of when you think about the future and the kind of economic impact of all of this? What do you think the long-term impact will be for you?
I'm not 100% sure. At the company I work for, they provide food for restaurants and supermarkets. We're having a bit of an upturn at the minute with everyone panic buying and stuff. But the restaurant side, the catering side, that's sort of slowing down a bit. So I'm kind of slightly concerned. I'm not going to lie, I've been looking for new jobs, obviously, to see if there's anything not there. One of the biggest things is we all got a letter just at the beginning of the crisis saying they are cancelling our pay review for about 3 months, which was nice of them. It was very sneaky. It snuck out under the radar. A few companies like that.
Thank you so much, and thank you, Nikki, both for sharing your experiences. As I say, it's really hard as journalists not to be able to come and see you and report on what's happening around the country. So it's really interesting to hear your experience. And you mentioned the kind of issue of food insecurity there. Well, let's come next to MD Mominul Hamid, who is running a food bank in Newcastle. Hi, MD. Thank you for joining us. Is your sound
Thank
right?
you.
Hi.
Yeah,
Perfect.
the sound is okay. So hello, everyone. Good evening. I'm MD from Newcastle. Before I start, I just got quickly to tell all of you guys what I'm doing and why I'm doing it. And obviously, I will make it very brief and quickly.
Thank you.
I know the time is very precious. Okay, so it is difficult time for all of us. So I hope everyone is okay and safe and not thinking about breaking the social distance at the moment. So being an asylum seeker last 2 years in the UK myself, I have gone through a tremendous real life experiences. So just to ensure that I can assure you, the hostile environment didn't stop me to do something. So as you guys know that Britain is the 5th richest country in the world, still many disabled people and the people are in benefit has lots of them has committed suicide, and still people are suffering because of the system is engineered to fail them. So it is not that we cannot afford to help them, but we choose not to do so. So I think before the so-called lockdown started, I had taken an initiative with a little health food bank idea in my mind to help the asylum seekers like me who's living on £5 a day. So I repeat, this is £5 a day, which is coming with no work right, and there is no access to public funds. So sometimes I get confused, am I a number or am I a human being? To be honest, I think I'm a brown fish on the wrong side of the river. But to be honest, this is why I started this initiative with a small food bank. And in desperation, I think people, my mom actually, she passed away last year this time, that taught me to be kind and loving to the people of others. So it is not suffering alone that taught me that importance of caring to others, but it is the unconditional love of care of my mother, which inspired me on her teaching to be love and care for everyone. So in desperation, people do all kind of things, as you know, but in distress, we always have a choice to be kind and care to each other. Even in dark and grim days, we have a choice to make, and I have chosen to be kind. I always remember my mom, when she passed away, she told me that, son, be there for people no matter what, something good will happen in return. But yeah, thank you. I haven't finished yet. There is a lot of questions you can ask me, and also critical questions, long questions, short, personal, anything is welcome. I'm really open-minded.
Well, listen, what I would really love to ask you about, MD, is so you have been delivering food parcels to vulnerable families, mostly asylum seekers in the Newcastle area. What are you finding there? Tell us about the work you're doing there, and the situations for the families you're seeing. I can't imagine living on £5 a day must be really tough. But in moments where people are stockpiling and it's hard to get to the shops, it must get really complicated. Tell us what you're seeing.
To be honest, my help to my community, whatever I'm doing, it didn't stop in only with the asylum seekers. When I started, actually, it was on my mind that because we get £5 a day, that I should start with these, but it has expanded a lot. I have helped elderly people. I have helped elderly people who is in chemotherapy. They cannot go outside of the house. I have got some sort of people are in quarantine who cannot really go out for their health conditions. I have lots of immigrants in this community. Obviously, I don't do publicizing and stuff like this, but as I work in local citizen advisor, so I had the depth understanding that what is going inside the inside the community. So when you see those people, I mean, I would like to share with you because it makes me cry always. I have dropped one food bag to one people one day. I don't know that person. It was a notice in their door that please keep away from me. I'm in self-isolation. I'm an old guy. I used to leave him the food packs, and one day I gave him a food pack last week, and he came outside of the door and his eyes was watering. So this is something really basic needs, which is food for the people like us and everyone in this country. And we should think about this at the beginning, because food shortage makes people desperate. And it is not good at all to leave people like the vulnerable people in the community in this kind of moment like this.
What are you finding people need the most? What in terms of what kinds of food people need?
People don't really ask you for fancy food or generous food or takeaways or stuff like this. All we need just a basic stuff, very, very basic stuff. Like I provide around 12 items, like which stands on the middle of the food bank. Like most of the asylum seekers, as you know, they come from different countries, so our food habits are very different. So what I did actually, I made some food packs which stands on the middle, like the locals can have it, and also the asylum seekers can have it as well. Like when the asylum seekers go to the local food bank, they leave half of the food on the food bank because we don't consume them, but we obviously some religious views and something else comes on the middle, so we don't take them. So I made a food parcel which is available on my blog and also in my YouTube, that how you make them. It is something people really need. Is the basic stuff, trust me, very, very basic stuff. Nobody is asking for anything more than what they need at this moment.
Well, MD, thank you so much for sharing your experience. It's really inspiring, and I think people do really, you know, it's very motivating to hear your stories. And there's lots of love for you in the chat I'm reading as we go, including from my colleague Liz Mosley, who I'm sorry I should have introduced. My colleague Liz is fellow editor at Tortoise, who will be curating the conversation in the chat tonight. Sorry, I forgot to introduce you, Liz. And I think kind of raises the point about cultural sensitivity and actually your lived experience relating to the people who you're helping and understanding what they need and what they don't need as well. So thank you so much for sharing it. I thought I might come to Lorna Harris, who's been chatting about her experience of socially shielding and is an old pal of mine. Hi Lorna, how are you?
Hi. Hello.
How's it going for you? You were talking about shielding.
Yeah, it's pretty hardcore, got to be honest. I think that I got the text message that come through. It's pretty brutal if anyone else got it. It just said, you know, you've been identified by the government as somebody who could be seriously ill if you get the coronavirus, and you have to stay in 12 weeks. You're not allowed to go out of your house. You have to stay 3 footsteps or meters, you have 3 footsteps away from anyone you live with, and you're only allowed to open a window. Do not leave your house. It was like this big kind of thing that came through. And I think, you know, for me, I live on my own, and I work in the charity sector, and I work with people, some of the most marginalised people of all ages. And I just thought, can you imagine getting that? Like my dad passed away last year, but he was very unwell, and I just kept imagining him getting that text message and trying to like work it out on his phone, how to read it and what it meant, and did it mean he was going to get ill? And yeah, really difficult, I think, for everybody concerned.
It's really interesting you raised that, because in the chat I can see my colleague Fliss talking about the fact that she hasn't had the text message yet, and she's on chemo, whereas Louise is saying that she got it by mistake, and she doesn't have she shouldn't have got it. So it sounds like that whole process must have been. Where were you when you got the message, Lorna? And how
I was out. I was at work. I think it was just like, I think I was just sorting out things from my office to be able to kind of come and lock down. And I got the message, and I think what's interesting is you get different advice from your actual doctor. So when I spoke to my specialist was saying, well, actually, you're on immunotherapy. You've been really well for the last couple of years. So if you want to go for a walk, that's fine, but avoid Tesco's. You know, it was that sort of thing.
So Waitrose is okay?
Waitrose is, avoid Tesco's. Waitrose is always okay. But no, it was like, don't go near the shops, don't go anywhere where there's going to be people, don't go into a supermarket, but you are okay to go outside your front door, get some air. So really difficult, I think, for other people that don't potentially have a support network, and also really difficult for people who are not defined by anything that's privately happening in their health, to then have to tell your employers that you've got to stay in for 12 weeks. You may not want to share the reason why. People may be wondering the reason why, and it's perfectly okay for somebody not to share. So I think that's what's been the most interesting thing, was that, you know, I've now got friends who are delivering my shopping and things like that, but if people didn't have that, it would be awful. So yeah, tricky time.
Thank you so much for that. Thank you. I'm going to come to Fliss next, who's my colleague who was just talking about not having got that text message. That was quite interesting. Are you there, Fliss?
Can you hear me?
Yes, I can hear you perfectly. How are you?
Yes, good, thanks. So yes, I was just waiting around for my text message, as you do, thinking, well, surely it's going to come. And it didn't. And as I said, you know, I'm on active chemotherapy. And then I spoke to my chemo nurse, and she sent me the link to the government's website. So you have to go and fill in this form saying, yes, I'm vulnerable and I've got these, you know, conditions or whatever, and all of your details. And then I got a text message about 2 weeks later from the government saying, well, if you were vulnerable, your doctor would know about it. Get in touch with your GP. which I did, and they said, well, it isn't really something that we're doing. It's NHS England that are sending all of these things out. And honestly, I've just gone round in circles. And my surgeon and oncologist have written me a letter saying, yes, highly vulnerable, needs to shield for 12 weeks, and which is great, but I don't know who to send that letter to. So it's a bit of a mess.
It is, and it's interesting that NHS England are coordinating the letters rather than local, but rather than your doctors or your local trust that knows you.
Yes, but the fact that my GP can't help with this is just baffling, absolutely baffling.
Yeah.
They obviously have all of my records, they can see what treatment I'm on. Yeah, it's really strange, very strange.
I'd just like to add that the whole
this is my mum, by the way.
whole family are in lockdown because of Felicity, because we don't want to bring any infections back. And we've been in the terrible position where we can't get an Ocado or Tesco or Waitrose delivery slot. And my point was that if you've got cancer or you're on treatment, there should be a code that you should be able to type in so that you get a priority slot, everybody who's on chemo or who's on vulnerable, so that they only have that code to be able to enable them to get a delivery. Because it's awful trying to rely on friends, that there are 4 of us in this house and we can't go to a shop, and we're relying on either a food delivery or friends to pick up bread and milk.
I think it's obviously there are people who are vulnerable and fall into the poverty category, like you were saying earlier on. But then there are people who are vulnerable where, you know, it isn't that they need a food bank, or, you know, I don't need the government to deliver me a box of carefully selected food, but if they could just give me 1 delivery food slot a week, that would be amazing. If it was just guaranteed 1 slot a week, then, do you see what I mean? It's really feels like such a basic request, but anyway, there we go.
Yeah, that's a really important point, and thank you so much. It's lovely to see you. We miss you.
This is my first digital thinking. It's so exciting.
Did anyone in the audience want to respond to any of that, either on the work in security, the food, or we've gone into this really interesting area of other vulnerable people? If you want to chip in, raise your hand or comment in the chat. But I'm going to, the second half of this thinking, we wanted to think about a subject that we've covered a lot over the past year, and I've reported on for Tortoise, which is around how the state decides to separate families when a child's at risk from neglect or harm, how the state makes the decision. And through the reporting we've done over the last year, we've really seen a threadbare system that is making decisions very differently around the country, that disproportionately impacts on poorer families who could be supported to stay together if we put the money into supporting families rather than separating families. And over the past week, we did a smaller closed thinking with lots of people who work in this area, and were exposed to this idea that at the moment where there is more need to support families than ever, social workers, the legal system has lost its contact with people. And so I wanted to kind of bring that issue to this group and to hear that, because I think it's something we're not hearing about very much. And I'm very pleased that Natasha Watson has joined us. And Natasha is Head of Safeguarding and Law at Brighton and Hove Council. Hi Natasha, thank you for joining us. I wanted to ask you to kind of paint a picture of how the family justice system is functioning now in the context of coronavirus. And starting by saying, are the number of care proceedings going up as families come under more pressure?
That in itself, that's a really good question, because what we've seen in my particular authorities, we initially saw a spike of emergency cases where the evaluation of risk really changed very quickly, because all local authorities have been asked to think about over years, managing more risk in the community, working constructively with families, trying to keep them out of the care system. And if you think about what you need to do that, what you need is active support in the community. Never seen a public inquiry that says at the conclusion of it, what this social worker needed to do was spend less time with the family, look for less support and spend more time behind a screen. And so what my social work colleagues are facing is this real dilemma at the moment, and they've had to very quickly rag rate all the families they're working with.
What does rag rate mean?
Rag rate means think about level of risk. Is this a red case, really, really urgent, we're really, really worried? Or is this one where children with granny is fine, we can make sure everyone has enough food and we're not so worried about that family? And for the families that we're really worried about, what are the things that everyone would expect us to rely on? It's information about how they're doing. So that would be information that the social worker would ordinarily get using their own eyes and ears by meeting with that family, meeting with that child. That's very, very difficult to do now. Of course, you can do it remotely, but if you think about it, remote doesn't always give you a sense of what's going on, and people can choose what to show you, and you don't know who's in the background. So if a social worker has a chat with a child and the child is saying, yeah, it's all fine, I'm managing, no, mum's not using at the moment, it's all great. How do we know that mum isn't standing behind them, telling them what to say? We obviously have families where the traditional toxic mix is domestic violence, drug and alcohol misuse, issues around poverty and all the stress that comes with that, mental health issues. And what are all the things we know that we're going to see more of under lockdown? Entirely justifiable increase in stress, all those issues of poverty exacerbated. Domestic violence we know is on the increase, and we've seen that around the world because of all the stress that comes with any family, however functioning, that comes with lockdown. And then what we've taken away from social workers is some of the tools they used to work with families positively. So what we worry about at the moment, what I worry about and what my social work clients that I serve worry about is what we don't know. The flip side of that is that we have seen families work really positively under tremendously difficult circumstances. We have families who have actually been willing to FaceTime with their social worker and kind of do a FaceTime tour around the house and open up the fridge and show what's in the fridge. They've met with people on the doorstep. They are still allowing some professionals to come in the home. Of course, needless to say, these are professionals who, generally speaking, don't have access to PPE because everyone's having to make a choice at the moment about how to prioritise the use of PPE. And I suppose the thing that I worry about at the moment, I worry about the things I don't know. Like, you know, I can do it remotely, but it doesn't have smell-o-vision. It doesn't tell me what's behind that door that no one is opening. It doesn't tell me if someone's been prompted to say things. But I also worry about families' access to justice in general. Solicitors locally have been absolutely brilliant about handing out mobile numbers as their firms close so that we can get access to good legal advice to parents who need to get it rapidly. We've got courts that are trying to stay open remotely. So we're doing telephone hearings, we're doing some hearings by video. But what that has meant for me is that I've discovered there's a form of poverty that I hadn't really thought about before, and it's internet poverty. Because all of these things rely on people being able to access things remotely. And if you have a smartphone or a pay-as-you-go phone and it's running low and you're running out of time available on it, then for us to say to that family, well, actually, what we'd like you to do with your last little bits of data is tune in to a remote court hearing, which might last for 3 hours on and off. So to help you know whether you can keep your child or not. So these are really, really big challenges for us.
Really big challenges. Can I just dig into that point about the rag rating? So when you knew the way the world was changing and that you wouldn't be able to have face-to-face contact with children as much, when you didn't have the safety net of school and families to help flag when something was going wrong, and you had to reassess rapidly every child on your books. Were you raising the bar or lowering the bar to intervention?
Well, it's an interesting question because, of course, the cases that you would ordinarily get the most attention from people like me are children who are in care proceedings, and we're trying to determine where their future is going to lie, and they're going to go back to their families, are they going to stay in care, should they be coming out in care? And then suddenly that all just isn't the big issue. The big issue is really, really basic. Are they safe? And actually that threshold of what we would consider to be good enough is very tricky to evaluate now, because cases where previously you would have thought, do you know what, this'll do, because although we're really worried about those parents, granny's coming in every day, the school's acting as a protector, so sometimes with all those things gone, crises develop really, really quickly. And there's no doubt at all, the reality is there is nowhere in the country where there won't be some children who are just really vulnerable and they are suffering and we don't know about it. And
just chilling.
That is the reality. And it isn't for lack of trying, and it's not because people aren't wanting to think through ways to do this safely. But as I said at the beginning of this, there's no standard which has ever said what you need to do to evaluate risk and help families is stay away, spend less time with them, and ask less other organisations to keep an eye on them, and be a way of children being able to say, actually, I've got something I need to tell somebody.
Thank you so much for that. I want to come to Becca Dove, who has her blue hand up. And Becca, I know, is a social worker. Are you there, Becca?
Yeah, I'm here. Sorry, my video is not working, but yeah.
All right, that's fine. Do you want to just briefly? Do you want to tell us what you're seeing? Do you want to name your local authority, or would you prefer not to?
Yeah, no, I will. I'm quite happy to.
Camden,
so, yeah, that's freaky that you knew that. But yes, I work in Camden. I actually run family support services. I don't work in statutory social care at the moment. And I guess I think the first thing to say is we've got 400 families that we're working with at the moment, and I love every single one of them. They are very, very special people. And I want to just kind of add a bit of a note of hope, really, that in Camden, one of the things that matters more to us than anything else is families' connections to their communities. That matters during normal times. It matters even more so now. And that lovely phrase of John Block's, that when the professionals leave, only family and community remain, is something that we hold very dear. So during normal times, I guess we want to try and think about the role of community and people that live in communities, and children and families that live in communities, as just a quintessential part of how we help. And I want to share with you, if I may, it's not my story, and I always worry a little about appropriating other people's story, but a story from this week to give you just an example of what I mean. I had a call from one of my family workers about a family living in temporary accommodation. Mum is pregnant and has chronic morning sickness. She has a very anxious child who is bedwetting a lot, and particularly now during COVID, incredibly anxious. And the laundrette had shut. She had no way to clean clothes. Now, leaving aside the enormous inequality of that, you know, in the hands of someone else, you might be thinking that's neglect. And that's a shocking way to think about what was happening to this mum. So we picked up the phone to one of our amazing community organisations called The Winch, who we know very well, and we work alongside them. They're part of our family support offer in Camden. You know, we're all equal. And said, look, the state doesn't have the answer to this. Do you? And within 2 hours, they'd not only offered to open up their centre, which has a washing machine in it for mum to do her washing there. She was going to have to do all of her washing by hand, by the way, which is sheets,
Well, listen, Becca, thank you so much for sharing that. It's really important to hear these stories, because this is the reality of people's lives now. So thank you very, very much for sharing that. I wanted to, can we come to Casey next? Casey is Casey Armstrong. Hi, thank you for joining us, Casey. Casey, you're a care leaver, aren't you? So you're kind of at the other end of this system in a way, I suppose. Do you want to tell us your story and your experience, and then how you're being affected by this situation?
Yeah, so I'm obviously a care leaver. Not everyone actually knows what that means. So basically, I spent time in foster care growing up, and I am estranged from my family, so I don't get any support there, and it is really difficult. And as much as social care is sort of technically called our corporate parent, where they are supposed to fill that parental role where they're missing, they don't, is just the most simple way to put it. So at this time, I mean, I'm 20 years old, I've got health problems, so I only work sort of on a 0-hour contract each month, so I can go month by month on how well I'm feeling. So in terms of work, I don't get any kind of sick pay, because when you go on 0-hour contracts, you don't get any kind of furlough or sick pay or anything like that with it. And instead, I've just sort of now been dropped to deal with just my universal credit payments alone, which unfortunately it's not enough. If you're under the age of 25, you actually get less money, because for some reason you're considered to be a cheaper living person. I don't know, it doesn't make sense. So I'm definitely struggling financially at the minute. It's very, very isolating, because it can be hard to make and maintain friends as a care leaver. So I'm currently sort of hoping and leaning on charities to try and keep me above water, pretty much.
And are you finding that there is support out there to help you on that basis?
Yeah, there is one charity that's local to me called Leicestershire Cares, and they are really helpful. They've been helping me for a little while now, and they do things sort of online sessions, like they've done mindfulness workshops, and they do quizzes in group chats for people that don't have as much phone data. And they're actually supposed to be off this week because of Easter, and I think I've spoken to about half of the staff members already this week, just because they're still working and they know that we're all struggling at the moment. So they are there in terms of isolation to help out with that. But unfortunately, when it comes to finances, I mean, my local authority seem to throw food parcels at me, thinking that that's going to fix everything. But that doesn't exactly solve that I'm struggling to pay my phone bill. That I mean, someone mentioned about internet poverty. I'm struggling with that at the moment. I've got about 2 gig data left on my phone, which I'm hoping lasts me through this call. And
thank you for using it with us.
Sorry?
Thank you for using it with us.
Well, it resets in a few days, so yeah, it should be okay.
So Natasha was asking in the chat, do you still have a social worker? Is the local authority still working with you?
Yeah, I do. When you get 16, get someone called a PA, which is personal advisor. and she's brilliant. She's been specifically assigned for me because she's sort of the mental health PA of the team, but she was ill and she went off of work 2 weeks ago, and nobody told me about this until her senior manager saw me on the news saying that things are hard for care leavers at the moment, and she went, oh no, that's not good, someone from our local authority is making us look bad. So that's the only reason that they're now in contact with me. So I can imagine there's a lot left about, unfortunately.
Well, Katie, thank you so much for joining us today. And I can see there's a lot of comments in the chat about your point about internet poverty and not being able to access the internet. I was trying to think about, in other contexts, when people are trying to homeschool, if you have lots of children and no free device and no internet, how do you actually keep on top of? There's so many of these cracks of inequality that run through this story wherever we go. I'm going to come to Louise Tickle next, who is a journalist who has written a lot about this whole issue about the care system. Louise, are you there?
Yes, I am. Hi.
Hi. Sorry, did you? What was the point you wanted? Yes, I can hear you perfectly.
Well, there are a couple of points I'd like to make, but just briefly on Casey. I mean, Casey's situation just makes me really angry. Her local authority should have provided her with a personal advisor that is there. It's her go-to person. It's her single point of contact, and it's not good enough for a local authority to abandon effectively care leavers in this situation, because they are highly vulnerable people. Often they've not been parented well by the corporate parents, as it's called. And so for a young person aged 20 with health condition to be effectively left alone in this situation, and I know Casey is not the only one. I've heard some really shocking stories about young people who have just left care, who are in dire circumstances, and because they are not the responsibility of the care system in quite the same way anymore, or even at all in some senses, in the same way as children in care are, then I really fear for their welfare, because they are often completely alone and have no recourse to a relationship with their parents, because of course that is often the reason why they're in care in the first place. But the couple of things that I wanted to mention are really about children who don't have a very public voice, and that's children in the care system now who are, as I understand it from a variety of foster carers, really struggling to maintain the court-ordered contact with their birth families that they're entitled to. I mean, I've heard of foster carers having been issued with large numbers of tablets and smartphones, and local authorities and foster care agencies making sure that they have devices on which these children could potentially do Zoom calls and FaceTime with their parents and their siblings, with whom it is so important that they retain a relationship, and particularly if this is to go on over months. But of course, nobody's thought necessarily that the birth parents, who may be living in absolute poverty, may simply not have the resources, the devices, or the technological expertise to be able to facilitate these kind of online conversations, which God knows are hard enough for us all to have grappled with in a professional context over the last few weeks. And so, I mean, I'm also hearing that, while some local authorities are being really painstaking in making sure that some contact is happening. Contact's a horrible, cold word for what is really the ability to maintain a relationship between you and your mum and your dad and your sisters and brothers. Other local authorities are taking a really blanket view as to the fact that this is dangerous. There is no facility, we can't supervise it. Contact centres have closed down, which is these rooms where people go to have supervised contact with their mum and dad, and that is just simply not happening for some children. The other thing which is going on, and again, these children are not children who ever really come to the public eye, are if your mum and dad have separated very acrimoniously, and they may have gone to the family court, fighting really hard to be able to have time with their child, and a court order has been made. Well, of course, now what's happening is that parents are at times weaponizing the fact that we are told that we have to stay within one household. And although they are completely allowed, children are allowed to move between households completely freely, although obviously it's as well to take advice and to be careful if there's anyone who needs to be shielded. I mean, I'm hearing from lawyer friends that those children are being retained by certain parents and not being, you know, swapped so that they can have their normal contact with both parents. And so their way of life has been substantially disrupted. And that can either be through genuine fears from one parent that the other parent isn't taking the isolation measures seriously or the social distancing seriously, or it's being done in a really acrimonious way because one parent sees, oh, well, we've got the child now, so actually we've got a good argument not to send them to the other to the other parent's house. And it's going to be very hard for a court to enforce any order at the moment.
Louise, thank you so much for talking to that point. Incredible stories to hear from all of you. Hannah Green has been in the chat talking about her experience and whether she counts as a vulnerable person or not. Hannah, are you there?
Yeah.
Hi Hannah, how are you?
All right, yeah, thank you.
So do you want to tell us what your experience is at the moment through this?
Yeah, so I have PTSD, so I'm not technically classed as vulnerable, but like obviously with everything that's going on, I can't mentally deal with kind of being anywhere near people, or I can't deal with going to a shop. So like if one of my friends dropped food off for me, like she's offered, but I think if it got to the point where I was out of food, I think I'd feel too kind of cheeky to ask. Yeah.
And whereabouts do you live, Hannah?
In Scarborough.
In Scarborough. And do you know, do you have a lot of community around you? Someone in the chat is asking, are there any mutual aid groups you can get in contact with? Because people really want to help at the moment, don't they?
Yeah, there is a group on Facebook. So it is there, yeah. I think it's just probably pride.
It's hard to ask, isn't it?
Yeah.
I guess the thing is that people really do want to be able to help at the moment. If you went to your GP, would you be able to be classed as a vulnerable person?
I don't know. To be honest, I don't even think I'd go to my GP right now. I'm really concerned about kind of putting extra pressure on the NHS and things like that. So I don't think I would go to my GP.
I can see Lorna in the comment is saying that she really identifies with what you're saying. It is really hard to ask for that help. Yeah. I wanted to come back to Natasha Watson, just to pick up on what we were saying before. Just to dig a bit deeper into that, because what I don't understand about the kind of the child protection system being effectively frozen in this time is whether there is a big backlog of cases building up behind it, or whether people are being fast-tracked through in much weaker, much less just ways, just to follow up on what Louise was saying.
I mean, there is a real tension because there are still cases which require really significant decisions to be made, and not making a decision is a decision in itself. So there are undoubtedly children who are significantly at risk, and there has to be some form of hearing. And the worry is that with the best will in the world, even a video hearing where everyone can phone in, there are still people who are really going to struggle to manage that. So I'm thinking of cases where we need translators. We can still do a video hearing involving a translator, but you can imagine it's far from straightforward. It takes a lot longer. We have cases with parents with learning disabilities where we want to have an intermediary to ensure that they can really understand everything that's being said in court, so that they can give their lawyer proper instructions and make sure that they're answering any questions from the judge in a way that's fair to them. And that is very, very difficult to achieve remotely. It's not impossible, and there are some cases where we can do it. But the reality is we are going to have an enormous backlog at the end of this. And there's two ways to look at that, because obviously everyone has a different evaluation of what's a priority case. So the straightforward evaluation for the local authority might be that child is safe because that child is in care, or that child is safe because that child is placed with extended family and we think that extended family are doing fine. And that sounds straightforward, doesn't it? Because it's not straightforward if you're the parent or you're the family member that thinks that child should be with you and not with the other family member. So then for you to be told, well, you might have to wait 3 to 6 months before you can have your day in court so that the judge can make a decision about that, doesn't feel like justice either. So these are a lot of balancing factors, and a lot of work is trying to be done at the moment to see if we can have effective video hearings, but there are some real drawbacks to that at the moment. In fact, the president of the family division has just issued a consultation on that in the next 2 weeks. Really, we're trying to do immediately something that ordinarily would have been years in the planning. And of course, one of the things that this has revealed is that the courts do not have adequate IT for what is being asked of them, let alone anyone else.
Thank you so much for that. I just wanted to come very briefly to Jude from Sounddelivery, who's our partner on helping bring some of these voices onto this platform to have this conversation today. Jude, do you just want to reflect on some of the things we've heard about today?
I mean, I always find it really moving and important when we are hearing directly from people who are at the heart of the story, affected by the issues. So Hannah and Casey, you know, we need to hear these stories if we're going to understand what's going on and create change. So for me, there are so many stories that aren't actually being necessarily heard in the mainstream media at the moment, and it's absolutely understandable that the stories we're hearing are very much the medical, the care system, what's going on. So really huge stories, or the very positive fundraising story, the £6-7 million fundraising story, which is important as well. And what's happening is some of these other stories are being squeezed out. And so really the opportunity tonight just to hear, you know, the stories in Grimsby, the poverty, and really a key thing is about digital inclusion and phones and access and things like that. But what absolutely gives me hope and keeps me going are stories that you're hearing from Becca in terms of the community and the community stepping forward and helping each other. And as we go on and hopefully move forward, you know, community is going to be more important than ever. And community has always been there, but it's about stepping up. And what's interesting, it's probably the most vulnerable groups, supporting the most vulnerable groups. I mean, Becca would probably know more than me, but that's what gives me hope, keeps me going, and just really drives my passion really to ensure that these stories are heard.
Jude, thank you so much. Usually it falls to me at the end of a think-in to summarise the conversation, draw out the strands of the important things we've heard, but I think Jude has just done that really beautifully. So thank you, Jude, for that. I do think we need to think about the digital poverty point. I mean, that could be a really strong campaigning point for Tortoise, and you hear it in so many different parts of society. And I think the one thing I'd add to Jude is what really struck me in the conversation tonight is that this crisis really comes down to the details and in the fabric of people's lives, about whether you can get a shopping delivery that works for you, about whether you can wash your sheets at night, and just how disrupted all our lives are. And if they were hard to start with, how much harder it's making it now. I want to say a huge thank you from Tortoise for all our speakers who joined us tonight. It's incredibly important to hear your voices. We will take this into our journalism and report it really faithfully, because it's really important that it gets that platform. I wanted, so someone in the chat was asking for MD's contact details, wanting to give a donation to his food bank service. So MD, do put your contact details in the chat, and we'll keep the chat open for 5 minutes at the end of this. So anyone who wants to swap contact details can do that. But I want to say a huge thank you to everyone for joining. It's been a really, really important conversation, and we take it incredibly seriously in our journalism, that we will deliver the stories that are not being heard elsewhere. So thank you. Good night.